Started. Good afternoon. Thank you for watching this webinar. Today we are going to be learning some more about different health insurance options that are available in the Commonwealth of Virginia, as well as cancer screening options if you are uninsured or don't have access to private insurance through an employer. We have Gayle Clary, the Community Outreach Coordinator with the Outreach and Consumer Communications Unit with the Department of Medical Assistance Services. She's going to be speaking about Medicaid and famous moms today. And then we will hear from Heidi Miller, who is the Every Woman's Life Clinical Coordinator with the Virginia Department of Health. So thank you both for being here. Appreciate it. And Gayle, if you're ready, you can take it away.
Okay, yes. Thank you. As she said, I'm Gayle Clary. I'm Community Outreach Coordinator for Medicaid for the Roanoke region in South Florida, Virginia. I've worked for Medicaid since 2015, serving Governor McAuliffe's Healthy Virginia Initiative and Governor Northam's Medicaid Expansion and Maternal Health Initiative. I'm happy to be here today. I'm so happy to share some information with you about Virginia's health insurance plans. They're very helpful to individuals and families. They're low cost or no cost. So I'm going to share my screen and give you a little bit more information. Okay, these are our logos, as you can see, with our website, Cover Virginia, and Famous. Famous is Virginia's health insurance program for children. Famous and Famous Plus are both Virginia's health insurance programs for uninsured children. Famous provides coverage for children and families who earn a little bit too much money to qualify for Medicaid. They fall in that gap. But it's really hard for them to afford private or employer-sponsored insurance. And then Famous Plus is our name for children's Medicaid in Virginia. To be eligible for Famous or Famous Plus, children must live in Virginia, be under the age of 19, be a U.S. citizen or a lawfully residing immigrant. When you make an application for Famous, the parent's immigration status is not considered. You do need to meet the income guidelines, however, and for Famous only, you need to be uninsured at the time you apply. We do have a screening tool on our website, CoverVA.org, and you can go use that screening tool to make sure that you qualify for Famous before you drop your other insurance. You want to make sure that you're going to qualify. It's a wonderful plan. It covers doctor visits, dental care, emergency care, mental health care, vaccinations, vision care, and hospital visits, among other things. We couldn't get everything it covers on this slide. These are the income limits in effective January 13th, 2021. So you can see now a pregnant woman counts as a family of two. So she could earn up to $35,711 and still insure her child under Famous. And what we hope is that with the new adult care coverage in Virginia with Medicaid expansion, we hope that someone who qualifies for Famous moms at the end of their pregnancy and their postpartum period will go directly into the Medicaid program, Famous, for pregnant women. I'm going to give you a quick overview of our new adult coverage. It was passed by the General Assembly, went into effect January 1st of 2019. It's quality, low cost, and no cost health insurance for adults. Adults age 19 to 64 can qualify as long as they do not qualify for Medicare. This helps a lot of people who work in industries that do not offer health insurance to their employees. So if you're an individual and you're earning less than $17,775 per year, you can qualify for health insurance under Medicaid. And of course, that covers a lot of students who are out there, or part-time workers, and so it's very helpful to them. I do community outreach, so I thought I would tell you a little bit about what I do. I work with my community partners. I work with public school nurses, pediatric and adolescent health centers. I try to go to all the private school nurses and private schools and give them information about FAMUS and the healthcare coverage for adults. I go to preschools, after-school programs, teen centers, youth parks and rec programs, sports. And then, of course, I attend as many community events as I can. I go to back-to-school celebrations and festivals. I go to health fairs. I visit all the back-to-school events and public library and literacy events in our area. And I try to take information and provide that to parents or to the adults who are with their children, give them information about our adult programs as well as our children's programs, so they have that information to plan. It's a wonderful financial tool for families as well because it saves them so much money. You can apply for coverage in several different ways. You can call our call center at this number and apply over the phone. You can do an online application at Common Health, which is a lot of people like to do that because they can also apply for SNAP benefits at the same time they apply for Medicaid. You can do an online application on the health insurance marketplace. You can mail or drop off a paper application at your local Department of Social Services. And then you can also call social services and apply. I would encourage you to use the screening tool on our website before you make an application. Save you some time if you're not eligible and you want to know if you are eligible. And this kind of gives you an idea of what our website looks like. And that's coverva.org. And this is my contact information. If you would need to contact me for any questions, this is the address. I did want to tell you about some of our current initiatives, though. I've been working on the maternal health initiative in the last couple of years, and we are pursuing prenatal coverage for pregnant women regardless of their immigration status. We are pursuing the extension of postpartum coverage for FAMUS moms as well as Medicaid for pregnant women to extend that coverage to 12 months instead of 60 days. Doulas are now covered under Medicaid, and we have dental care for adults for the first time that begins July 1st. We're working on a back-to-school campaign now, and so those are kind of some of the things that we're working on at Medicaid. Thank you very much, and let me know if you have any questions.
Thanks, Gayle. I actually do have a couple questions.
Okay.
First, I know that for a long time, there was a 40-quarter rule for folks who had immigrated to the United States and residing in Virginia. They had to work for, I think it's 10 years, wasn't it? For
yes,
eligible for Medicaid, and that's no longer the case?
Yes, thank you for asking that question. The 40-quarter work requirement for legally residing immigrants has been removed, and we're so thankful for that we can now help that population, because prior to that, they did have to show 40 quarters, which is 10 years of work requirement. So yeah, that's another initiative we've gotten taken care of. So
yeah, and that is really helpful for, I think, a lot of folks. We need to, we're happy to do our part getting that information out there that, you know, if you were denied,
yeah,
try again, because things have changed.
Thank you. And the other, you know, our adult coverage is so helpful also, because we were not able to, there were so many people prior to Medicaid expansion who could not get health care coverage because the income guideline was something like $7,000. And you had to make less than $7,000 to get covered. And, it was just so hard. So now, it's 17,700 and something for a family size of one for an individual. And that covers x-rays, maternity, newborn care, long-term care and support services, behavioral health services, prescription drugs, doctor, hospital, and emergency services, and so much more. But those are, it's a really great program.
Yeah, and could you give me a little bit of information around particularly the cancer screening and cancer treatment services, like those, if you're enrolled in Medicaid, you can get your cancer screenings and then also get treatment through Medicaid, and just basically you have something to help you pay for the cost of treatment.
Yes, and Medicaid covers any service that is deemed medically necessary. So it would cover any service that you needed for your care.
Excellent. And you mentioned the the maternity care being extended past 60 days. I mean, I can't imagine, going through birth and then only having 2 months of health insurance afterwards, because, folks who go through C-sections and things like that, that can be a long recovery process and you need the support. So I'm really encouraged that we've extended that.
Yes, and we applied to the Center for Medicaid Services to have that extended to 1 year postpartum. And I think that is a wonderful thing for our moms. So I'm excited about that.
Have other states?
We've had a lot of, pardon?
I was just wondering if other states have had that extension and been successful.
I am not sure. I know that Virginia is a leader in some of our maternal health initiatives. We have made, in some of our initiatives that we've undertaken in the last couple of years, Virginia has been considered a leader in the services that we offer. And I'm not sure if other states have made application for that or not. Let's see if I had that information. I know that we had a lot of support for that. But my information, we're securing federal approval for it, and my information does not say whether other states have applied or not. That's a really good question. I can find that out and let you know, though.
Yeah, that would be great. Yeah, thank you so much for your time. Is there anything in particular that you didn't have a chance to say that you'd like folks to know about the Medicaid program in Virginia?
I guess the one thing I would like for people to know, we do so much community outreach because people do not realize that they are eligible for coverage, and they have children who are uninsured and they are uninsured. And so I would ask them to share any information they heard today with their friends and neighbors, and to always, check our website. You're probably eligible for a lot of things that you don't realize you're eligible for, and it's your tax money that has paid for this. So, it's your right to have that coverage. So if you qualify for it, so you want to keep up to date and share the information with your friends and neighbors.
Well, thank you, Gayle. And sort of segueing into what Heidi is going to talk about, if you don't currently have health insurance, or you don't know that you can qualify for Medicaid, and you're looking to get cervical or breast cancer screenings, we have a program that might be your entry into the Medicaid coverage in Virginia. So Heidi, could you talk a little bit about Every Woman's Life?
Sure. Give me 1 second to pull up my screen. So as Erin said, I am Heidi Miller. I've been the Every Woman's Life clinical coordinator for the last year now, in the midst of a pandemic. It's been interesting learning a new job, but I love it. I love the amount of people that we're able to reach and help with this program. I myself was familiar with the program before I started with it, but certainly not in the detail that I know now. And I realized that some people weren't familiar with it at all. I mean, there are still people, even within the health systems that we serve, that don't know it exists. So thank you for the opportunity to share today. So let me do that. There it goes. So Every Woman's Life is part of, is one of 70 national breast and cervical cancer early detection programs. Early detection of breast and cervical cancer is known to reduce mortality, as we're aware, but there's a disproportionately low rate of screening among women and of racial and ethnic minorities, as well as uninsured women. So to address this issue, Congress passed the Breast and Cervical Cancer Mortality Prevention Act of 1990, and it led to money being given to the CDC in the form of this program. And since 1991, these programs have provided more than 15 million breast and cervical cancer screening tests to nearly 6 million women, leading to the diagnosis of more than 71,000 breast cancers and 4,800 cervical cancers. The program is administered by the CDC's Division of Cancer Prevention and Control through cooperative agreements, and it has expanded over all of these years to include all 50 states, the District of Columbia, 6 U.S. territories, and 13 tribal organizations. So why is this work so important? This is just a glimpse into the national impact of this program over a 5-year period. So this is our last 5 years that we have reported out. Nationally, we reached 1,185,780 clients. And this is a number of unduplicated clients. So if we saw someone in follow-up or rescreen, they weren't counted. 629,899 received cervical services such as PAPs, HPV testing, and ultrasounds. 1,007,475 received breast services, so mammograms, clinical breast exams, and MRIs. 72.4% of the clients that received the cervical services and 69.3% of the clients that received breast services were racial or ethnic minorities. All of these clients could have potentially gone without care if this program was not in place. In Virginia, our NBCCEDP program, as it's called, is Every Woman's Life, or we use EWL for short. And our mission is to provide high quality breast and cervical screening, diagnostic and health services to low income, uninsured women in the most cost efficient manner. This map shows you our provider coverage. And as you can see, we pretty much cover the whole state. We have 25 provider sites. Even the little gray in the southwest corner, that still is a coverage area. So our aim is to meet as many individuals as we can where they are to get them services close to home. I mean, as you would realize, though, some of these rural areas, there is a little bit of a drive, but we're closer to home than if they had to come to Richmond or any other safety net hospital to get their care. Eligibility criteria. So to be eligible for enrollment in EWL, we serve women who are 18 to 64 years of age. And I say women, and I apologize, individuals is the terminology we have in all of our documentation. It's just habit for me. So individuals that are 18 to 64 years of age, we serve. Anyone that's 65 and older may qualify for the screening portion of the services, but typically that population is covered by Medicare. And if they're not, we try to help them get services to be covered by Medicare. If for some reason they still don't qualify, we will serve them for their screenings, with the caveat that they probably will not qualify for Medicaid if they are diagnosed in our program. female in gender, so this includes transgender women or men who have taken or are taking hormones for greater than 5 years are eligible for EWL, and female to male as well as male to female. Uninsured, Virginia residents, and have a household income at or below 250% of the federal poverty level. So by this graph here, a one-person household, the potential client can make $15.48 an hour and still qualify. Additionally, individuals with Plan First or gap insurance are eligible. So what we tell clients is if you are in need and you think you might qualify, reach out, we'll assess you, we'll try to get you connected with whatever services we can. Clients that are not U.S. citizens may receive EWL screening and follow-up, but those clients will not be eligible for the Breast and Cervical Cancer Treatment Act if they're diagnosed with a precancer or cancer of the breast and cervix. The clients that this applies to will be made aware of this when they're enrolled. And typically, all of our providers have a setup where those clients can be directly funneled into charity care at one of our bigger centers to have coverage, because we don't want to leave anyone in a lurch. Our priority population is those that are over 50, those that are less than 100% of the federal poverty level, minority individuals, and individuals who are rarely or never screened for cervical cancer. And those are people who haven't had a Pap test or gynecological exam in 5 years or more. So what do we cover? We cover lots of services. So one of our main focuses is case management or patient navigation. So this is a collaborative process that assesses, plans, implements, coordinates, monitors, evaluates the options and services required to meet any health needs. Essentially in EWL, our goals for case management services are completion of a needs assessment and any barriers to care at enrollment. If barriers are identified, interventions to eliminate or lessen the burden are implemented to the best of our ability. Notifying clients of abnormal results, answering questions, and assisting with scheduling or follow-up of treatment. Referral of clients to other resources when non-cervical or breast issues arise that are not covered by EWL, and assisting clients with the application process for the BCCPTA to make sure that they do get enrolled into Medicaid and receive those benefits that they're entitled to. We also do a lot of patient education. So this handout that's shown here is what you need to know about what you need to know about the Every Woman's Life program. It's provided and explained to all clients when you're enrolled. And the information covers the importance of screening services, and what can be expected, what the client can expect on their end if additional testing is needed. Client education is essential and fundamental to the EWL program. Health information provided during client visits includes making positive lifestyle choices and decisions, critical information about the importance of routine cancer screening exams. Each client is provided with information that is culturally and linguistically appropriate about the purpose of all of the testing that we do. An emphasis, of course, is placed on routine screening, lowering mortality for breast cancer, and decreasing an individual's chance of developing an invasive cervical cancer. We also make sure that we include things about healthy lifestyle, including low fat or low salt diet, increased activity to lower the risk of chronic diseases such as heart disease, high blood pressure, and diabetes. Clinical services that we cover. So we cover a clinical breast exam, which is basically your physical exam by your provider, a screening mammogram. Current guidelines for when to do the screening mammogram vary between organizations, but EWL supports annual mammograms at this point. And then cervical cytology with screening cervical cytology screening for with PAP and HPV testing. We support that yearly, whether or not the PAP and HPV are due. So a gynecologic exam is paid for. And just so that you're aware, current screening guidelines are cytology alone in individuals 21 to 64, or every 3 years, or every 5 years, cytology and HPV testing together for women ages 30 to 65. If any of these screening tests produce a positive result and other procedures are required to get to a diagnosis, we make sure that we cover that under the program. And then the EWL program, we have 2 categories of clients. So I'm mentioning age a lot, so just to clarify. We have clients that are 40 to 64, and those clients cover, we cover breast and cervical screening regardless of their lifetime risk for cancer. The other age group is 18 to 39, and those women qualify for screening services if they are at an increased lifetime risk for cancer, or they are symptomatic in some way at the time of their visit. Sorry. So the Breast and Cervical Cancer Prevention and Treatment Act, this is the program that gets our women into Medicaid. So clients who are screened or diagnosed with breast or cervical cancer or a precancerous condition and certified as needing treatment by an EWL provider may be eligible for that treatment under Medicaid under this act. To be eligible for this, you have to be a Virginia resident, age 18 to 64, screened and diagnosed through the EWL program, in need of treatment, and meet Medicaid's non-financial requirements. In addition to that, U.S. citizen or qualified alien, not eligible for Medicaid under other groups, and no creditable health insurance coverage. So any people that we're unsure about in the EWL program, we go ahead and submit their application to the Department of Social Services, because there are times when these people do fall into a certain category under another coverage group, and they're able to get covered. So treatment coverage. So once approved, qualified clients receive full Medicaid coverage. So if they have anything else that comes up while they're on treatment for their cancer or precancerous condition, they can get treated under Medicaid just like anyone else would. It's active beginning the first day of the application month, and sometimes is retroactive back even 3 months' time, which even covers their screening sometimes that they had through EWL. They're covered for the duration of treatment. So if that treatment goes on, if they're on hormonal therapy for breast cancer and that goes on for 5 years, they're covered for 5 years under Medicaid. There's just a recertification process every year that's handled on the back end, not anything the patient has to handle. When treatment is complete, the client's unenrolled from the Medicaid coverage group. And there may be a minimal charge or copay for the Medicaid services, as Gayle mentioned earlier. So to get in contact with EWL, we have a phone line that an actual person answers most of the time. So you're welcome to call there. And we also have an email. That email goes directly to me. I answer everything personally and make sure that you get in contact with the closest contact in your area. And follow up with you to make sure that you don't need anything additional going forward.
Thank you, Heidi. Really appreciate that. That's something that kind of struck me when I began this role at VVCF, that there there's this great program, but people don't necessarily know about it. Even physicians don't necessarily know about it. Yeah, I know someone personally who got breast cancer treatment through and is finishing up treatment through the Every Woman's Life program. So it's just such an important thing to have. And I want to focus on one thing you mentioned, is that if younger people are symptomatic of, like, so if someone is 20 and finds a lump, they can, and they're uninsured, they can call Every Woman's Life and they'll get screened.
Absolutely.
So yeah, that's an important thing to focus on as well, because it's not just the regular screening mammograms, but it can be. So, I mean, if someone is just uninsured and wants to be sure that they get their mammogram every year, they can do that, even if they're not symptomatic. So it's a great resource here that we have. So one question I have is, so with the change in the Virginia Medicaid rules when it comes to the 40 quarter, does that have any impact on EWL qualifications, or are you able to get more people connected to Medicaid as opposed to the Treatment Act funding?
So it hasn't affected a lot. We have noticed that a lot more women qualify for Medicaid expansion now. So we're able to just kind of, no, wait, you qualify over here, and get them into that group. We find that a lot of times when we're sending the applications to the Department of Social Services, that they're finding different groups that these women can fall into that they didn't know they could fall into. So regardless of how we're helping them, we're getting them there.
That's great. And, you know, again, because you were focused on cancer screenings, particularly during this past year, what was that like? What was the experience? Because I know there's a lot of news out there about people dropping off on cancer screenings. I haven't heard much about cervical cancer, but I imagine the same was true has been reported for breast and colon cancer. Have things come back up? How long was it down? Any kind of information about that experience?
So cervical cancer is always lacking. For some reason, individuals are just not, it's not your favorite thing to do. So people don't just run out and get their cervical screening like they should. So overall, what we saw was back in March, April, there was a steep fall off. We got to where it was almost no one was getting screened. Wow. And we've been on a steady incline the other way. We're going back up. We're not quite at the numbers that we were at last year for screening. We're trying to get out there. We're trying to push everybody needing to get back to screening, because we're going to deal with another crisis, unfortunately, in our country if we don't get back to it soon. Luckily, we are moving back up, so our numbers are looking good.
And that's interesting too, because I would imagine with many people losing jobs or having their hours drastically come back, I would think that there would be an increase in need potentially for these services. So hopefully we'll be able to get the appropriate folks in for the screenings that they need soon. I know that there's a national campaign by Prevent Cancer Foundation to get your screenings back on the books. So, you know, doctors' offices and imaging centers, they've been safe through this whole thing. They're used to sort of illness control measures. So if you haven't scheduled your screening yet, please do so.
Absolutely.
And Heidi, is there anything else about the EWL program that you wanted to say that you didn't have a chance to say?
I think you just said it. We need to get back to screening. We can't help you if we don't know you exist. And I'm trying to make sure that everyone else knows, all the, potential clients out there know that we exist, because we need to get the numbers back on track.
Absolutely. Well, thank you both for information that you shared today. I think it's incredibly valuable, and especially with things that have changed recently with Medicaid, it's really important to remind people of the resources that we have in the state. And if you weren't able to get health coverage services before, apply again. Things have changed. There are new programs. So please get out there and see what you can qualify for. So thank you both.
Thank you for having me.
Thank you.